COVID-19 is a virus that can cause a spectrum of symptoms from the common cold to severe pneumonia. This virus is transmitted from individual to individual through droplets from the nose or mouth, spread when a person coughs or sneezes. It is crucial to maintain a social distance of at least 1 meter from a person with symptoms. COVID-19 was first detected in China with the first case confirmed on 7 January 2020 in Wuhan, China. The first case in Malaysia was confirmed on 25 January 2020. The World Health Organization (WHO) declared COVID-19 as a pandemic on 11 March 2020. Since 20th September 2020, Malaysia has entered the beginning of the third wave of COVID-19 following the sharp increase in COVID-19 virus infection cases. The policies to restrict movement and quarantine to prevent the transmission of COVID-19 is not only has psychological effects such as depression, anxiety, and stress, but it also closes the economic activities. Border closure and travel restriction policies also cause cross-border economic shock by influencing production factor and demand. This policy had a huge impact on the domestic business and caused declining incomes, job losses, and insolvency.
Movement Control Order (MCO). To help counter the COVID-19 pandemic, the government of Malaysia initiated the MCO effective on 18 March 2020. In order to increase social distancing and slow down the transmission rate of the virus. Closed border. Consistent with the MCO, Malaysia has implemented a policy to close all border gates to prevent the spread of COVID-19. However, Malaysia has allowed certain group of entries to enter Malaysia. All arrival from abroad and all entrants must also undergo a mandatory quarantine for 14 days at the designated center. Good public health management. Ministry of Health (MOH) immediately implemented a precautionary measure by activating the COVID-19 Operation Room, which is known as National CPRC, to monitor the situation during infection. Press statement and health education material are issued daily to provide information on the development of cases to Malaysians. All citizens are also compulsory to have the MySejahtera application in their mobile phones to enable the Ministry of Health to make immediate action if required. Economic Plan. MCO has a serious impact on the national economy. The government has introduced several economic stimulus packages with the aim of reducing the effect of the economic downturn with the total of 315 billion ringgit Malaysia in 4 separate packages. The main objective is to help relieve difficulties encountered during the MCO period for the low and the middle income group and others. 2021 Budget. The allocation of 322.5 billion ringgit Malaysia in 2021 budget is to reveal the economy and help Malaysia to cope with the COVID-19 pandemic. 2021 budget strengthens the previously announced economic stimulus packages.
There are 3 recommendations that can be considered by the government of Malaysia to reduce the impact of COVID-19. The first one is by giving automatic targeted loan moratorium. This measure will help low-income B40 and the middle-income M40 people as well as the traders who are facing economic recession. The second recommendation is through economic opportunities. Malaysia must invest in a renewed trajectory. Pandemic COVID-19 creates business opportunities, especially in the food and agricultures, electricals and energy, health and wellness sector. The third recommendation is through public health, where ongoing data sharing and shared policymaking initiative between country medical staff in Southeast Asia are necessary. Diverse clinical specialization should use all necessary channels of communication to exchange knowledge, learn from each other and join forces from other regions of the world. In conclusion, the MCO that was enforced by the Malaysian government to slow down the spread of COVID-19 has affected all industries. To reduce the impact of MCO, the Malaysian government has allocated a big budget to various sectors to reduce the economic impact. All Malaysians have shown their full support for MCO compliance to ease the burdens of the frontliner, particularly medical personnel, in dealing with the growing numbers of cases every day. Each person plays a significant role in ensuring that the society and the country are free from COVID-19.